Greg Simon. I'm the president of the Biden Cancer Initiative. Our focus is to be a premier convener and catalyst for change. Nobody's better at convening and catalyzing effort and change than Joe Biden. And we want to look at some of these cultural issues that act like a sail in the water. You think you're going fast, but if you took the sail out of the water and put it where it's supposed to be, you'll find you're going much faster. So what are those sails in the water? Lack of data sharing, lack of data quality and standards, lack of good designed clinical trials that are better for patients, lack of access to the new therapies we do have. Those kinds of structural problems hold us back, not just in developing treatments, but making an impact with the treatment. It's not enough to develop a treatment. People have to have access to it. They have to be able to afford it. And we have to reward the innovator at the same time. If this were easy, it'd be done already. It's complicated. But we know it's complicated, and we've been working on this for a long time. I want to know that people get checked early so they get diagnosed quickly, that they get the best care possible, because no matter where you are, those doctors there know what the best care is, not because they've sat down and read 5,000 volumes of New England Journal, but because they're in touch in a network with the best doctors in the country, and they can share data, and they can share knowledge. More importantly than data even, it's the knowledge that comes out of the data. Did this work? In what people? For what reason? At what time? In combination with what drug? In what order was the combination? All of these things matter. Someone who's seen a rare cancer 100 times has a lot to teach someone who's never seen it before. They never meet. And they can't just go look it up. So I'd like to have a cancer system that learns on experience the way we as humans do. And then I'd like to know that that patient who's properly early detected and diagnosed and is now being treated can be in a facility that can give them privacy, can give them attention, that can give them assurance they're getting the best standard care available, and if that doesn't work, that they know how to get them into a clinical trial wherever they have to go, not just at that institution or in that city. And is that ambitious? Apparently it is. But if you ask most people on the street, they think we do that already. They think we do that already. We don't. That's the embarrassing part, is when I have to tell people, no, we don't do that already. And we should, and we can.